The grid's dead. Hospitals are dark. Pharmacies emptied in 72 hours. You're in your kitchen when the knife slips. Small cut, half an inch. You wrap it and forget it. 3 days later, your hand is swollen. Red lines crawl up your arm. Temperature spikes. That cut just became a countdown. Without antibiotics, infection is a death sentence. Bacteria don't care civilization collapsed. One Staphylococcus aureus cell divides every 30 minutes. In 12 hours, one becomes 16 million. Your body is a buffet. Without chemical intervention, you're betting your immune system wins a war it's designed to lose. But chemistry didn't vanish with the power. The principles that made antibiotics work are in your pantry now. Salt, honey, garlic, vinegar. You need to know how to use them before infection uses you. Here's how you turn kitchen garbage into life insurance when there are no doctors left. Method 1. Salt water. Not the ocean, not tears. Chemistry. Boil 1 quart of water for 5 minutes. Kill everything. Add 2 teaspoons of table salt. Stir until dissolved.
Let it cool. This is saline solution. Here's why it works. Normal saline is isotonic. It matches your body's salt concentration. Won't damage healthy tissue while it cleans. Tap water is hypotonic. It makes cells swell and burst. That slows healing. Salt creates an environment bacteria hate. Osmotic pressure pulls moisture from bacterial cells. They dehydrate, they die. Your cells survive because they're tougher. Now irrigate the wound. Don't dab, flush. Use pressure. You're removing debris, dead tissue, and bacterial colonies before they establish a beachhead in your flesh. Pour the solution directly into the wound. Let it run out. Repeat 3 times daily minimum. Store your saline in a covered container for up to 1 week. Label it. Date it. This isn't cooking. This is survival chemistry. Salt water isn't fancy, it's physics. And physics doesn't negotiate with infection. Method 2. Honey. Raw honey. Not the processed garbage in a plastic bear. Raw, unfiltered honey contains glucose oxidase. When honey contacts a wound, body fluids dilute it. That activates the enzyme. It converts glucose into gluconic acid and hydrogen peroxide. Hydrogen peroxide is a disinfectant. Your body manufactures it inside the wound. Slow release. Constant. No degradation from light or air like bottled peroxide. Honey's pH is between 3 and 4. Acidic is orange juice. Bacteria hate acidity. Most strains can't survive it. Then there's osmotic pressure. Honey is supersaturated with sugar. When bacteria encounter that concentration, water gets pulled from their cells. They dehydrate. They die. Your cells are tougher. They handle it. Here's how you use it. Clean the wound with saline. Pat dry. Apply a thin layer of raw honey directly to the wound. Cover with a clean bandage. Change twice daily. The honey will liquefy from body heat. That's normal. That's chemistry working. This isn't alternative medicine. This is biochemistry older than pharmacies.
Method 3. Garlic. Fresh garlic. Not powder, not pills, fresh cloves. When you crush garlic, you rupture cells. Inside are 2 compounds, allicin and an enzyme called allicin. They're separated. Crushing brings them together. They react. The product is allicin. Allicin is a reactive sulfur species. It kills bacteria, including multi-drug resistant strains. It oxidizes proteins in bacterial cells, disrupting enzymes and membrane integrity. Bacteria can't function, they die. Here's the procedure. Crush 2 fresh garlic cloves, let them sit for 10 minutes. That maximizes allicin production. The enzyme needs time to work. Mix the crushed garlic with 1 tablespoon of raw honey. This dilutes the garlic's intensity. Pure garlic can damage healthy tissue. Honey moderates it while adding its own antimicrobial effect. Apply the mixture to a clean wound, cover with a bandage. Leave it for 2 to 4 hours maximum. Remove it, clean with saline. Repeat once daily. Don't leave garlic on skin longer than 4 hours. Allicin is aggressive. It doesn't distinguish between your cells and bacterial cells. This is controlled chemical warfare. Precision matters. Method 4. Vinegar. White vinegar. The active ingredient is acetic acid. It acidifies the wound environment. Most bacteria prefer neutral or alkaline conditions. Lower pH disrupts their metabolic processes and cell membranes. Acetic acid is effective against Pseudomonas aeruginosa, a wound pathogen that resists standard antiseptics. Concentrations as low as 1% destroy biofilms, those slimy bacterial communities that resist everything else. Here's the dilution. Mix 1 part white vinegar with 4 parts boiled cooled water. Soak a clean gauze pad in the solution. Place it on the cleaned wound, leave it for 15 minutes, remove it, rinse with saline, pot dry. Apply once or twice daily. Don't exceed 15 minutes. Prolonged exposure irritates tissue. The acid doesn't discriminate if you give it too much time. This method works when bacteria establish strongholds. It penetrates biofilms honey and garlic can't reach. Vinegar is 6,000 years old as medicine.
Good, you know how to fight infection. Now you need to know when you're losing that fight. Early infection looks like this. Increased pain after day 2. Normal wounds hurt less as they heal. Infected wounds hurt more. The pain intensifies, it throbs, it spreads. Redness expanding outward from wound edges. Some pink is normal. Red streaks radiating from the wound are not. Those streaks are lymphangitis, bacteria traveling through your lymphatic system toward your core. Swelling that doesn't decrease after 3 days. Initial swelling is immune response. Persistent swelling means bacteria are winning. Warmth around the wound. The area feels hot. That's increased blood flow as your body fights. Thick discharge. Pus. Yellow, green, or cloudy fluid with foul odor. That smell is bacterial waste and dead white blood cells. Your immune system is in combat. These are early signs. Manageable signs. This is when salt water, honey, garlic, and vinegar can still work. But there's a line. Cross it and household chemistry can't save you. Here's the red line. Fever above 102 degrees Fahrenheit or temperature below 96 degrees. Your body's thermostat is failing. That's systemic infection. Confusion or altered mental status. You can't think straight, you're disoriented. That's bacteria in your bloodstream affecting your brain. Rapid heart rate, over 100 beats per minute at rest. Your heart is working overtime, trying to pump oxygen to tissues bacteria are destroying. Rapid breathing, over 22 breaths per minute. Your lungs are compensating for metabolic chaos. Extreme pain disproportionate to the wound size. That's tissue death. Decreased urination or no urination. Your kidneys are shutting down. Dizziness or lightheadedness when standing. Your blood pressure is dropping. That's septic shock. Cold, clammy skin or skin that looks mottled, blotchy, or blue. Blood flow is being diverted away from your extremities to protect vital organs. This is your body in triage mode.
If you see these signs, household chemistry is over. You're past the point where salt water and honey can help. This is sepsis. This is organ failure. This is death knocking. Without intravenous antibiotics and medical intervention, survival odds drop by the hour. Here's what you need to understand. Infection isn't bad luck. It's physics and chemistry playing out in your tissue. Bacteria are organisms optimized by billions of years of evolution to consume organic matter. That's you. Without intervention, bacteria win. They always win. The question is whether you know enough chemistry to stop them. Salt water works because osmotic pressure is a law, not a suggestion. Honey lurks because glucose oxidase doesn't care if pharmacies exist. Garlic works because allicin disrupts protein structures. Vinegar works because acetic acid changes pH and bacteria can't adapt fast enough. These aren't folk remedies. These are chemical reactions that have been killing bacteria since before humans invented language. The difference between surviving and dying isn't hope, it's knowledge. It's understanding your kitchen contains antimicrobial compounds that predate modern medicine by millennia. It's knowing exact ratios, exact procedures, exact timing. 1 teaspoon too much salt damages tissue. 1 hour too long with garlic causes burns. Precision matters because chemistry doesn't forgive mistakes. But you also need to know when chemistry isn't enough. When bacteria enter your bloodstream, when your body starts shutting down. Recognizing that line is as critical as knowing how to clean a wound. Pride doesn't survive sepsis. Stubbornness doesn't cure organ failure. There's a point where household methods end. Survival isn't about being tough, it's about being informed. It's understanding that infection is a chemical process, and you either control the chemistry or the chemistry controls you. In a world without doctors, that knowledge is the difference between a cut that heals and a cut that kills. Master the chemistry, recognize the signs, act before bacteria do. That's how you survive when there's no one left to save you.